Can weight loss medication cause brain fog? Does Zepbound cause brain fog? That's a question a lot of people have when they start this medication, and the answer is more nuanced than a simple yes or no. So let's start with what we actually know. Zepbound, the brand name for tirzepatide, is FDA approved for chronic weight management in adults with obesity or in adults who are overweight and have at least one weight-related health condition. It works by activating two receptors, GIP and GLP-1, which together help reduce appetite, increase feelings of fullness, and lower overall calorie intake. It's a once-weekly injection, typically started at a low dose, and gradually increased over time based on how you're tolerating it. Now, when it comes to brain fog specifically, here's the key thing to understand. Brain fog is not listed as an established side effect in Zepbound's FDA prescribing information. The most commonly reported side effects are gastrointestinal, things like nausea, diarrhea, vomiting, and constipation, and these tend to happen most during the dose escalation phase. That said, some people do report feeling mentally foggy or less sharp during treatment, and it's worth noting that just because something isn't on the FDA label doesn't mean it can't happen. It means it hasn't been established as a direct drug effect. So what might be going on? Research suggests these cognitive changes are more likely tied to what's happening in your body during significant weight loss rather than a direct effect of the medication itself. A few things can contribute. First, caloric restriction. When you're eating significantly less, your brain is taking in less fuel, and that can affect how sharp and focused you feel, especially early on. Second, dehydration. Zepbound can reduce appetite and cause nausea, which sometimes means people aren't drinking enough fluids. Dehydration is a well-known contributor to cognitive sluggishness. And third, nutritional changes. When your diet shifts significantly, your intake of key nutrients can shift too, and that can have real effects on how you feel mentally and physically. So if you're experiencing some brain fog on Zepbound, it's worth thinking about whether any of these factors might be playing a role. And that's a great conversation to have with your doctor. A couple of other things worth knowing. Zepbound is not recommended for people with severe gastrointestinal conditions like severe gastroparesis. And if you take medications that lower blood sugar, like insulin or certain diabetes pills, make sure to ask your clinician about hypoglycemia risk and what warning signs to watch for. On the practical side, talk to your healthcare professional about whether your hydration and nutrition are adequate given your current intake. And if you're concerned about how you're feeling cognitively, don't just wait it out, bring it up at your next appointment. It's also important to know when to reach out sooner. If brain fog persists beyond several weeks, gets worse over time, or comes alongside other symptoms like a severe headache, changes in your vision, or any neurological symptoms, contact your healthcare provider promptly. Those kinds of symptoms warrant a proper evaluation. One more important note. Zepbound is contraindicated in people with a personal or family history of medullary thyroid carcinoma or a condition called multiple endocrine neoplasia syndrome type 2. Make sure your doctor has your full medical history before starting this medication. So, to recap, brain fog is not an established side effect of Zepbound according to FDA prescribing information, though real-world experiences vary and persistent symptoms are always worth reporting to your clinician. Cognitive changes some people experience are more likely linked to caloric restriction, dehydration, or nutritional shifts that come with significant weight loss. And if you're concerned about how you're feeling, your doctor is the right person to help you sort it out. As always, nothing in this video is personal medical advice. Talk to a qualified healthcare professional about your own situation and whether this medication is right for you. If you found this helpful, drop a comment below. And if you want more content like this, make sure you like the video and subscribe to the channel. We'll see you in the next one.